Good morning or good afternoon. We are here to discuss what to expect before, during, and after your open heart surgery. Understanding the process will help ease any anxiety you may have.
To prepare for surgery, please follow these guidelines. No eating or drinking after midnight the night before surgery. Bathe with Hibiclens the night before and the morning of surgery. You should have received this when doing your pre-admission testing. If you are already in the hospital, this will be provided to you. This helps reduce the risk of infection. Take your beta blocker as usual in the morning, unless otherwise instructed. Bring a list of your medications to the hospital. You may choose to bring a change of clothes for discharge, any toiletry items you prefer to bring from home, and if you require specific shoes for walking, you should bring those as well. Arrive at the surgical admitting unit, SAU, 2.5 to 3 hours before your scheduled surgery time. You'll change into a hospital gown, have an IV started, blood drawn, and receive antibiotics. Remember to empty your bladder, remove jewelry, dentures, and any other removable items before heading to surgery.
You'll be given medication to help you relax before being taken to the operating room. You may remember entering the OR, which can be cold and bright. The anesthesiologist will administer medication to put you to sleep. Once asleep, you'll be connected to a ventilator to help you breathe. We'll insert a catheter into your bladder, an arterial line to monitor your blood pressure continuously, and a feeding tube so we can give medications directly into your stomach. Your surgeon will perform the necessary procedures. For a coronary artery bypass grafting surgery, the surgeon may remove a piece of your vein from your leg to use in your heart, and you will have an incision on your leg. After the end of your surgery, the surgeon will place chest tubes to drain fluid. These are often very uncomfortable and can be a significant source of pain. The surgeon will place 1 or 2 pacing wires, which are temporary in case your heart is beating too slow. They will close your chest using sternal wires and skin glue, and you will have a dressing placed over your incision.
Immediately after surgery, you'll be transferred to the Cardiac Intensive Care Unit, or CIC. One nurse will be primarily responsible for your care, but many will assist. The cardiovascular surgery team will also be heavily involved. You'll have various lines, medications, and monitors connected to you. These lines, cords, and machines can seem particularly overwhelming to you and your loved ones. However, this is completely normal, and our team is highly experienced in taking care of both you and the equipment used during your recovery. We'll closely monitor your vital signs. You'll gradually wake up while still on the ventilator, and this may be uncomfortable. Please follow the instructions from the nurses and the respiratory therapists to help with the ventilator weaning. We are working as quickly as we can to get you off the ventilator, and your cooperation is important to make sure things go quickly. Some patients may be able to be extubated immediately after surgery is complete and prior to arriving on the unit. This will be decided by your surgeon at the end of the procedure. Pain is expected after surgery. As you wake up and you are taken off the ventilator, we will continuously check to see if you are in pain. We will administer pain medication to help manage it, but we will not be able to completely take away all the pain. We want your pain to be manageable, to the point where you will be able to deep breathe, cough, and get out of bed. Once we have removed the ventilator, we will continue to monitor you closely. You may have ice chips starting a couple hours after the breathing tube is removed, and you will progress to sips of water. Family visits depend on how you're doing. We prioritize your care, so please be patient. We will allow 2 visitors at a time to stay with you after you are extubated or off the ventilator. However, we will do everything possible to allow your loved one to come visit you even for a few minutes after you've been back to your room for about 90 minutes. We encourage families to rest rather than staying overnight, as you'll receive one-on-one care.
We'll continue to monitor your vital signs throughout the night. Around 4 a.m., we'll help you sit on the bed and stand. The surgical team will assess you in the morning and may remove some lines or tubes. You'll be helped into a chair, and depending on your progress, you may start walking that day. The earlier you get up and moving, the faster you will be able to progress toward going home. Chest tubes will be removed based on drainage, usually on the 2nd day or later. Chest tubes are typically the biggest source of pain for our patients. The removal of these tubes should bring some relief from the pain. The urinary catheter will be removed on day 2 to 4. Mobility is crucial for recovery. Physical, occupational, and cardiac rehabilitation will evaluate your progress daily. Some patients may require home health care or acute rehabilitation services after surgery. Physical therapy and occupational therapy will evaluate your needs for these services while you are recovering from surgery. Hospitalization durations depend on how well you are mobilizing after surgery. You may expect to be discharged 5 to 7 days after surgery.
We understand this is a lot of information. Please feel free to ask questions. We want to ensure you feel prepared for your surgery and recovery.